Hello, my name is Robert Russo and I'm a rheumatologist at BJC Health, and I'm going to ask Rachel Butterworth, who's a physiotherapist here at the practice with expertise in treating ankylosing spondylitis, to show us the lateral lumbar spine movement test. This is a test used to assess lumbar spine mobility. So thanks, Rach.
Thanks, Rob. So I'm going to go through the lumbar side flexion test for assessment of lumbar side flexion for ankylosing spondylitis. So the first thing we have to do is make sure the patient's heels are right up against the wall, approximately hip width apart. Then they have to stand with their back up nice against the wall, arms feeling nice and long with their middle finger extended down as far as they can. We take that measure from the tip of the middle finger all the way down to the ground and measure what that is. Then we ask the patient to side flex to the side, keeping their back against the wall, making sure they don't rotate forward at all, that the back stays flush against the wall. And then we measure from the middle of the finger again down to the floor, and we take the difference of those two measures.
Well, thank you very much, Rachel, for showing us a wonderful example of the lumbar side flexion test for ankylosing spondylitis. So would you do the other side as well?
Definitely, and it's really important that you measure the baseline distances on both sides.
Do you take an average or do you take the worst?
No, when you do work out the BASME score, you definitely take an average of the two.
So was Errol normal?
Just, actually, he was 18 centimetres.
And so if he was restricted, would that have meant he had ankylosing spondylitis?
Definitely not. There are a number of reasons that can cause stiffness in the lumbar spine, and further investigations would have to find out what that cause is.
Well, again, thank you very much, Rachel, for showing us the lumbar side flexion test.